Okay, good afternoon. Today is September 29th, 2023. Welcome to the first episode of the Stat Regimen of Season 9, a series that provides recent updates on all things public health current to Rhode Island. My name is Jiwoo Lee, and I am a final year pharmacy student from the University of Rhode Island.
And I'm still Jeff Bratberg. I'm a clinical professor here at the URI College of Pharmacy and the Academic Collaborations Officer at the Rhode Island Department of Health. The opinions expressed in this podcast don't represent the opinions of the United States government, the Rhode Island Department of Health, or the University of Rhode Island.
Today, we're going to talk about the fall vaccination season. There you go. With
No
four
problem.
safe and effective adult vaccines to keep you healthy. And just in time for American Pharmacist Month.
I know. We have all kinds of fun things to alert people. So everyone seems to know somebody with a positive COVID test. I know I had it after traveling. Know lots of other people with it. But one important other public health effort is knowing whether you have COVID. You can get 4 free tests at covidtest.org. But the best way to avoid COVID symptoms and spreading it to your friends and family and loved ones is vaccination.
And speaking of COVID, there are some important updates here. The Centers for Disease Control and Prevention, or CDC, recommends that everyone 6 months and older get an updated COVID-19 vaccine this fall and winter. These updated vaccines will work against currently circulating variants. Some folks may call these boosters, but it's better to think of these as an annual update vaccines.
Yeah, just like influenza. And if you're wondering what to do because you had COVID, like me this year, experts suggest waiting 3 to 6 months before getting the updated vaccine. You're most likely protected with that immunity from the disease and hopefully prior vaccination. So you can extend your protection by delaying the vaccines, your annual COVID vaccine. However, if you're at risk, if you're older than 65, immunocompromised, have chronic health conditions, and you don't want to wait, that is totally fine. Some of us just need to get all these vaccines together, which is totally safe. So if you're getting a flu shot, get your COVID shot, and then you don't have to make another appointment.
Great. So the important question here is how much are you going to have to pay for this vaccine? If you have Medicaid or Medicare Part B, it is going to be fully covered and you won't have to worry about paying anything out of pocket. If you have private insurance, they are in the process of making adjustments to address recent issues and submitting the claims to insurance companies. So just keep that in mind and wait a little bit. And also please contact your provider and insurer to make sure that you get the right information on vaccination coverage. If you do not have any insurance, you can receive free vaccines at locations in the Federal Bridge Access Program run by the CDC. The information can be found online through vaccines.gov.
All right, so it's good to get everyone covered. We're removing all those financial barriers. But let's talk about another winter virus, the influenza virus. So just like COVID, we knew that when we all wore masks and socially distanced and got our vaccinations, eventually we can prevent the spread and consequences of flu. Probably people don't realize that we can prevent up to 100,000 excess hospitalizations and maybe 80,000 deaths annually if everyone got vaccinated against influenza.
Vaccine manufacturers are projecting that the U.S. will have between 156.2 million to 170 million doses of influenza vaccines for 2023 to 2024 season.
So no shortages. There's plenty of vaccine, plenty of access points, and again, no restrictions there. So everyone 6 months or older should get the vaccine. We're talking really about adults to get this vaccine. What's great is you can probably take your family, get them vaccinated. There are 2 vaccines recommended by the CDC for older adults. So make sure you recommend higher dose or adjuvanted vaccines. They work better for that higher risk group. And one big change in the guidelines, is that people with egg allergies can now receive the flu vaccine. If severe egg allergies can receive it in any setting, including community pharmacies. And so we're increasing access to those populations.
Okay, speaking of easy access, flu vaccines are covered by Medicaid and Medicare Part B without a copay for people in the state of Rhode Island. The state-supplied vaccine is free for people covered by private insurance. If you do not have insurance, there are public flu vaccine clinics for colleges, schools, and other community sites that will make sure that you get your vaccine and stay safe and healthy this winter. Go to health.rhodeisland.government flu for more information. And now let's move on to another important topic, RSV.
Right. People talk about the triple-demic last year, 3 viruses and 3, but only 2 vaccines. We have vaccines against all of them. So we covered the annual COVID shot. We've covered the annual influenza shot, all available to you. But now let's talk about RSV. So now you have the option, not just one vaccine against RSV, there's actually 3 vaccines. So individuals 60 years of age or older in that higher risk group can get two new vaccines, either made by Pfizer or GSK. Also, there's a vaccine specifically for people in their last trimester of pregnancy to protect their infants. So, what are the differences between the two vaccines, you were going to ask me?
Great question. So one is developed by Pfizer and the other is developed by GSK. So here, our Rexv vaccine was 83% effective against lung infections, like pneumonia, in the first RSV season after one dose. In the second season, it remained 56% effective. On the other hand, a Breezvo vaccine was 89% effective in preventing lung infections like pneumonia during the first RSV season after one dose, and it still works well in the second season. However, the study is still ongoing for a Breezvo, and the exact second season effectiveness is not yet identified at the moment. We don't have the exact number yet. So talk to your provider before you get your vaccine to discuss which one is right for you.
I think the big thing is people will say, oh my gosh, these are approved for the same age group. You've given me these numbers. Which one should I get? Well, number one, you should definitely get it. And number two, get whatever one's available to you. So if you're getting your flu shot, you want to get your RSV shot, do that. I think pharmacies and other providers are going to be promoting it. So again, talk to your healthcare provider about getting all three of these shots. They can all be given together. Again, you have lots of choices of influenza vaccines. Over 65, get the higher dose or adjuvated. If you're over 60, you get RSV, or if you're pregnant, you should also get that. We'll talk about that in a second. So ensure that you're protected against RSV by the time this begins to circulate sort of in your area. As for insurance, again, adults who are insured under Medicare will receive the vaccine without a copay or deductible, and many private insurance plans are covering, again, one or both of the RSV shots for adults 60 years and older who aren't eligible for Medicare, which begins at age 65.
Great. One last question here. Are pregnant women also eligible for all the vaccines we mentioned today mentioned in today's episode, Dr. Bratberg?
Yeah, they are. So it's very, very important, right? COVID, people who are pregnant are at higher risk of severe consequences from COVID and higher risk of consequences for influenza. So it's absolutely imperative that people who are pregnant or planning to become pregnant get the influenza shot. It's important that if you're in your third trimester of pregnancy, between 32 and 36 weeks, get that RSV shot. It works the same as your Tdap shot, which we didn't really talk about here. So there's 2 shots to get in your third trimester. Again, not to protect the person, but to protect their infant when they're born before they can get other RSV therapies and influenza at 6 months or 4 months for these things. So these are safe and effective vaccines. They prevent those severe side effects from these diseases. And again, the COVID-19 annual shot is also safe and effective for pregnant women. So please talk to your provider, talk to your pharmacist. As I wrote in my notes here, it's Pharmacy Podcast. Why don't you talk to your pharmacist about this if you have any questions about its safety. And you know what? People are like, gosh, we're really interested, G. Where can they get these vaccines?
Well, surprise, URI College of Pharmacy is actually having a vaccination clinic here. So we have an influenza vaccine clinic on Wednesday, October 11th from 10 a.m. to 3 p.m. right here at the URI College of Pharmacy, organized by Dr. Virginia LeMay. Our expertly trained and compassionate student immunizers are ready for you. Here, we're also offering COVID vaccines and any other vaccines you need. Just fill out a piece of paper ahead of time and let us know. This means you. And
if you're watching this on YouTube, G here is going to volunteer and be one of those student vaccinators. I think we're going to have a whole podcast of her giving me my flu vaccine. I may feel like and look like I'm 60, but I'm not yet eligible for RSV, so I will not get that vaccine. So we'll have a bunch of 4 stations led by pharmacy students and offering them to increase vaccine rates on campus. You don't need to be in pharmacy. You don't need to be part of the community. The vaccines are available for anyone who fills out the form. So again, October 11th, 10 a.m. to 3 p.m. right here in Avedisian Hall. Fill out your form, stop by, tell everybody to go.
Okay, thank you for tuning in to our stat regimen today. Stay informed, stay vaccinated,
and stay safe.